This is Whiskey, and as you may know, she has had, since she was 10 days old, she's now a little over a year, recurrent issues with coccidiosis. She was born as a C-section baby. Her mama did not get in any milk, so she didn't have any true colostrum. We didn't have any that was frozen or fresh at the time, so she only had powdered colostrum. Is better than nothing, but it's still not the same as real colostrum. We suspect that she just hasn't developed the best immune system, and what happens with coccidiosis is they get exposed to the coccidia protozoan parasite just from the environment. It's pretty much everywhere in a goat pasture. All of these other goats are most likely positive for coccidia. The difference is that these adult goats, their immune system keeps it in check, and so it doesn't affect them. So yes, they might be positive for it, but they aren't sick from it, which is what Whiskey's body should be doing. But if her immune system is compromised from not being properly colostrumed as a newborn, then that would help explain why she's having so much trouble just keeping this coccidiosis under control. We almost have a normal goat. She still gets half a day flare-ups of the coccidiosis, maybe a couple times a week, but it's only half a day. Her normal is unfortunately squishy and gross, kind of like dog poo, and even sometimes like runny dog poo. It's only when the coccidiosis is really flaring up that it gets really gross. She does still have flares. You can see there's staining on her fur. It'll dribble onto her hocks and things like that. So it still is present. We followed our primary veterinarian's recommendations for a year, and we decided that it was time to bring in a second opinion. We are keeping it under control. She's a happy, healthy goat. You can see she's got a gorgeous coat. This is a good body condition for a dairy goat. She's nice and sleek and thin, and that's actually where she should be. We tend to keep them a little bit plumper here just because that's my preference with how harsh Maine winters get. I like them to have body weight going into the winters. That depends on climate, and it depends on the individual goats. She's practically perfect weight rather than being a little bit over like we often have them. I wanted to try to see if we can get those flares to go down a little bit. We're going to try what is now the fourth antibiotic. Coccidia requires antibiotic treatment until the immune system can cover it for themselves. And so we started off using Corid, which is the standard of care. And Corid should work, but she's a freak of nature and we don't know what her issues are. So we also have tried Decox or decoquinate, which is fed through in grain, and that helped, but it didn't get rid of it. It would stop the flares, but it wouldn't make it stay away for good. We also tried a medication called toltrazuril, which is a little bit sketchy in the US. It is not approved for use in, I think, anybody, but definitely not for goats in America. It's hard to get your hands on. We had to purchase it from a, quote, lab, quote, in, I think it was Ukraine.